community member, Kathy Fischer. Kathy is the board chair of the Written Gift. She's also the Advanced Healthcare Directive facilitator, very active in that, and also parish nurse at the Church of St. Mary's. She has been an asset to Alexandria area, and her extensive work with older adults in this community is very admirable. All right, Kathy.
Well, hello, everybody. And again, thanks to Preeti for pulling this all together. If it would have been left up to me as the board chair, we would be looking at a blank screen. So, so thank you, Preeti, for all your hard work. You talk about things I don't even understand. So thank you for all your technology and all your knowledge and your enthusiasm for the Written Gift. Like Preeti said, I'm Kathy Fischer. I'm the parish nurse here at St. Mary's. I've been in this role since 2004. So of course, most of my population are older adults. Got interested in starting this nonprofit in 2016, and a couple of other people, we put our heads together and said, this is something our community needs. We need a community-based educational component to help people fill out their advanced directive. And part of that reason and my passion comes from personal experience with my own father, who was a quadriplegic at age 54 and also a bilateral amputee. This was in the 70s, and my mom and dad had talked about nothing. And seeing his progression and being in the hospital for 9 months, and what do we do at the next respiratory arrest? What about the next cardiac arrest? And it was a continual, we just have to treat because we don't know what dad would have wanted. And so that has been in my mind for many, many years and helped me probably in my own mind formulate what is a good way to look at advanced medical treatments, end of life care, etc. So that's kind of my own personal background. I had to smile. I think somebody said larger families don't make it easier. I'm from a family of 10, and that is exactly true. My own mother, who is now will be 94 next month, I've been bothering her for many years to get her advanced directive completed. And she would always say, Kathy, you'll know what to do when the time comes. And my response to her, but it's not what I want. What do you want? And it took a hip fracture and her being in rehab to see, I have 7 sisters, to see all my 7 sisters come in and say, Mom, you should do this, you should do that, you should do that. I finally used that example and said, Mom, this is what will happen. If you cannot communicate your own wishes, you will have 8 of your daughters trying to say what should be done, and nobody is going to know what you want done, and there could be some fracturing of the family. That's what it took for her to say, yes, I'll fill out my advanced directive at age 88 or whatever she was at the time. So my own personal experiences, and then of course with my clients, I have seen many wonderful deaths. I have seen some deaths that have fractured the family, probably on a permanent basis, because again, wishes weren't known. Families were maybe not always involved in the last years of that person's life to know what the progression of the illness has been. And I always often say a lot of times for some of my families, if the family member is not near and have not had the opportunity, just for whatever reason, to be an active participant in the parent's life, they want everything done because that's more of an emotional insurance for them, I sometimes feel. And maybe that's not true, but I've seen that many, many times. So also, I have seen beautiful deaths because they've had a written directive. They've had conversations with one another. So that person that is the healthcare agent gets the support of the other family because they are the one having to follow through and follow the directive that the person wanted. So I look at it as, yes, it's a gift to the family. It decreases angst. It decreases the unknown. It decreases potential guilt down the road. Did we do the right thing? Did we not do the right thing? And I think really it can bring the family together. They're all on the same page. They know what mom or dad want. They can support each other in that process. And then that just leads over into supporting each other in the grief process as well, in my estimation. It opens up conversations among the family. If there's somebody that has been designated the healthcare agent, and I make sure that they get as many copies as they want so they can give to all the family members, that opens up conversations amongst the family members as well. And I just think it's just, it is a gift. It is a gift that we as individuals can give to our family, to our loved ones, so that when the time comes, they can be present in the moment and loving you on the way out as you are loved on the way in. That's how I like to look at it. There's that unity, that this is what mom, dad, whomever it is, my husband wanted. I'm gonna give that back to them now in love, in love. And I often think, what could be a better way to leave this world, but knowing that those that love you are there gently caring for you and allowing you to die with dignity and respect. So that's one of the part of the advanced directive, and that I think it's such a gift. And it's a gift that goes both ways, of course. For us, as far as the written gift, one of our major focuses on education. I often say anybody can fill out the form, but are they understanding what they're saying yes or no to? Many of our facilitators with written gift have a medical background, so we can say, okay, knowing you have congestive heart failure, what does CPR mean for you and your condition? What are some underlying health conditions that you maybe don't understand what some of the treatments could be? And so we have the ability to explain a little bit more to them about that, about some of the treatments. And also, I think the main part, one of the parts of the advanced directive that I encourage all my clients to fill out is the 2 optional pages about your values and beliefs. I often say to my clients, we cannot predict every single medical treatment or decision that needs to be made. So it's important that you talk about your beliefs and this is what a good death looks like to me. This is what I think makes life worth living. Some of those optional questions that can touch upon other things and some of the goals and that a person has about their life. And that will help that agent make some decisions knowing some of those conversation pieces have taken place. So that I think is very important for us. And that's what we do at the written gift. When we facilitate with a client, it's at least a 90-minute meeting. And oftentimes they come back because they want to think about that optional piece. So I see our focus more as yes, the educational portion of it, the conversation with parents. And if we get to the point to get that advanced directive written, that's great, but let's go through the process and the steps to make it an informed decisions, understanding what they're saying yes or no to, and making sure that, again, that person that's an agent is able to follow through. When I talk to my clients, I say that probably the most important thing when you're looking at the health agent, who are you deciding who that will be, is yes, can they make a decision in a stressful situation? But more importantly, can they follow through on the decisions in the directive, even if they don't agree with it? Because that's kind of where I've seen it more than once with clients. That's that head and heart pull. The head knows what the directive says and what I need to do, but the heart has a hard time following through. So that's something I think that, and like you said, Pamela, so it's a neighbor, because it could be a conflict time with your family. And I have seen that in other situations as well. So again, thanks to all the people here that volunteered to be with us today. We're excited about the written gift. We're excited we can share information with people, and just tell your friends and neighbors we are available. We are a free service. We are doing this because we think it's very important for all of you. Thanks, Preeti.
Thank you, Kathy. That was wonderful. You got it right. Everything all together for the written gift.